Marc, as you would have gathered, is an expert surgeon. Sophie is an aesthetic doctor. I know you each refer people to whoever's vital, but Sophie, let me start with you. What we're talking about is here where treatments stop and where surgery starts, because I find for a lot of people who correspond with me, that is a really big question. Are treatments going to do what they want them to do, or should they be stepping up straight away for a facelift? I get DMs about it every week saying, why should I waste my money on these treatments? I'm saving up for a facelift. And you think, well, we can discuss that in a sec. But Sophie, when someone comes to see you for a consultation and they present, I don't know, a 50-year-old face, a 55-year-old face, what can you treat? Where can you take them? At what point do you need to refer? And so we need to hold this thing awfully close. You'll hear it when you're talking.
Thank you. So I would just say it very much depends on the person in so many ways, both in terms of their face and their anatomy and their aging process. And even though we might say a 50-year-old face, 50-year-old faces can look really different to one another. But also in terms of their willingness to go through certain procedures. So there are some patients who I might talk to and say, have you ever considered the surgical options? And they go, well, I was wondering about that. And then they're very open-minded about a referral. And then there'll be others who say, I know I don't want to go through a surgical procedure. And then there will be some of those who we can still help non-surgically. But what I will say is many people, we talk about fillers lifting. Fillers don't lift. They give an illusion of lift because they're revolumizing deflated structures, but they don't physically lift. And so there is a degree of tissue drop that is beyond what fillers can address. And that is where also a good aesthetic doctor will have a conversation about the fact that maybe surgery is a better option. And I think that's kind of all of our responsibility to know where the overlap is. And I know Marc and I have had many conversations over time about treating people who've had filler in the past. And I still remember the one a long time ago where Marc said to me about after facelift having said he found filler in the chin that the patient had forgotten they had because it was so long ago. So we're very used to I'm used to working on patients who've had facelifts, and Marc is used to working on patients who've had fillers. So there's often this continuum.
Thank you. Marc, is there a right age for a facelift? It's probably the wrong question, but...
Hi everyone, apologies for my quoted notes to start. There is no right age. It tends to be the perimenopausal time that people notice a very rapid change in their faces. So typically people will start thinking about facelifting around their 50s, 60s, into 70s, and I'm facelifting people in their 80s as well. I think the key question is, what is your goal? And very much in line with what Sophie said, thinking about your choice of treatment, whether that's surgical, non-surgical, or a little bit of both, is very much determined by what you're aiming to achieve. All the other little factors that are key that we'll all think of, what we're prepared to go through, how much we're prepared to spend, what the recovery, the downtime is going to be like, all these other aspects really have a big factor to play in.
And to that question that I was wondering when we just sat down about people who say, would it be better to save up and have a facelift rather than doing a lot of treatments? What do you feel about that? Is it better to come earlier, do it later?
A couple of thoughts about that. The first is that if you are sure that you're going to have some surgical procedure such as a facelift or neck lift in the future, I would be cautious about some treatment options I'd choose earlier on, because particularly some of the more high-powered energy-based treatments can cause a lot of scarring that can make my surgery a lot more challenging. If surgery is challenging, risks are higher, and you don't want to encounter any complications in any surgery. So that's one consideration. The other thing I'd think about is just remind me what's your...
What about would people, if people are thinking, should I just save up for a facelift instead of having treatments?
I think there was some... Thank you.
Yeah.
Both of us did. There are some treatments that I think are fantastic and cover multitudes of decades, such as Botox or neurotoxin. I think done well, there's almost nothing to lose. However, other treatments, such as filler, such as some skin tightening treatments, one has to think about not only your goals, what you're expecting out of them, but also when you might consider surgery if you're going to consider. If you're not considering surgery for 15, 20 years, then absolutely. Having lots of tweakments, I think, is very much on the cards. If you're considering surgery in a year or 2 years, maybe be more circumspect. There's no harm in having an early consultation with a surgeon to discuss almost a game plan, and then your cosmetic doctor can see you in the meantime and then work towards your goals, bearing in mind your date of future surgery.
Can I?
Yes.
There's one thing I would say, which is that no surgeon will ever complain about you having healthier skin. And so if I know that a patient is at some point open to having a facelift, I will avoid. There are some energy treatments which are okay because they're only working in skin, and others which I will say definitely avoid. Same with biostimulatory injectables. Generally a bad idea if you're planning a facelift, especially in the next 5 years. But things that work on your skin health and quality, including products and certain treatments, brilliant. And it can be, as we said, this continuum. But again, fillers can cause problems during a facelift. So it very much depends on when someone's thinking about it. And all of these treatments are an investment. And one big bonus of a facelift is the longevity compared with injectables. And so we know that some injectables can last a really long time, but what we don't want is one to impact on your ability to have a successful outcome from the other.
And I didn't know who to ask first. I guess people come in wondering about something like an eye lift. I'll talk more about this with Elizabeth, but I find for a lot of people who message me that they're starting to think about maybe an upper blepharoplasty almost as a sort of step between Tweakments and a facelift, because it's quite a straightforward thing. Do you get that?
An upper blepharoplasty is probably the biggest thing I refer, and such a high value and high impact treatment. When it comes to improving eyelids non-surgically, we can get results to a certain degree for many patients, but what you're spending is probably not far off what you're going to spend on a blepharoplasty for less longevity. And the healing, the recovery, the process of having an upper blepharoplasty is really, for most people, one that when they understand, it's not as scary as they thought. It's a really high impact treatment, and I will have it when I need it.
Not yet at all. Are eyelids one of the key things that bring people into your practice? I'm only wondering that. I would have thought it was an obvious thing people would come for, except that you're so well known for your kind of whole face work. Is it?
I think very much as Sophie has alluded to, eyelids are a very good first step to take in facial rejuvenation. They are a straightforward procedure. There's minimal downtime compared with many other procedures, and they're fairly low risk procedures. And you have that, I guess you could call it an entry-level procedure to understand what surgery is like, what surgical recovery is. Because to go straight from having never had any facial surgery to having a deep lane facelift and a deep neck lift can be a huge step to take for many people. So having that eyelid lift is often something that people will have first before going ahead. So, sorry about my mouth.
No. I feel mean asking you to talk. Can you talk a little bit about deep plane facelifts? Because they're something that most of us hadn't really heard about until 3 or 4 years ago, and now they're so popular.
And it's kind of fascinating because the concept of a deep plane facelift has been around for 20 or 30 years. In fact, the term was coined about 20, 25 years. When we think of facial aging, it's not the skin that's sagging, it's the deeper tissues that sag, and the skin's a bit like a passenger that comes down on those deeper tissues, both in the face and the neck. Now, therefore, to do a meaningful facelift, it's not the skin that's pulled tight, it's the deeper tissues that are lifted and repositioned, and there are different ways of doing that. But the most comprehensive, approach, and I think the one with the most natural appearance and the biggest longevity is when you go under those deeper tissues into the so-called deep plane, which is in perhaps a zone that some surgeons aren't comfortable with because it's near the facial nerve. You see all the facial nerve branches and other structures there. But that enables the tissue that has really been responsible for your facial sagging to be freed up and therefore lifted with very little tension, and therefore it doesn't want to be pulled back or recoiled. So it can stay up for a much more reliable length of time. So the deep plane concept is about freeing up that deeper tissue, repositioning it to where it used to be, and then the skin acts a bit like a passenger, and often we take very little skin off, and sometimes hardly any skin at all, depending on your skin excess, skin quality. And the key is not to put any tightness or tension on the skin, otherwise you're going to get bad skin bows, you're going to get that wind tunnel look, and you may get earlobes that are dragged down, a so-called pixie ear defect.
Yeah, the perils of it, but the deep plane results always do look softer. I find them very natural. I suppose is what I'm moving towards.
The key result is one that your friends would only comment on how well you look, not on whether you had down. For me, that would be an absolute sign of, well, I'd be mortified if any of my patients came back and reported that their friends had been asking, what do you have?
Okay, thank you. Right, we're nearly out of time, but in the interest of steering people into good aesthetic, the arms of good aesthetic practitioners or surgeons, what's the major problem with the Tweakments industry as you see it? Is it the lack of regulation? Okay, we could be here all night, but I know we've only got a minute. I would say it's the lack of regulation for non-surgical practices. Is that?
We have a huge regulatory issue with particularly the non-surgical space in the UK. So I would say looking for the British College of Aesthetic Medicine, which I'm a trustee of, we have a Find a Practitioner portal which can help guide you, and all of the members of that have been through a vetting process. And again, with surgeons, look at BAAPS, find an accredited surgeon, because there are a lot of terms bandied about for surgeons that are not a plastic surgeon. So again, you want to make sure that whoever's hands you're in someone with the right qualifications, the right expertise. Don't be afraid to ask questions, ask about experience, ask about insurance, ask about products used, and ultimately trust your gut. If something doesn't feel right, don't feel obliged to do anything. I never think it hurts to have more than one consultation. If I see a patient who's considering surgery, I'll encourage them to go and have a consult with a surgical colleague and then come back to me if this is the route they want to go down. And the same can go with seeing multiple practitioners in terms of multiple aesthetic doctors, or going and having a couple of surgical consults. It never hurts to see what feels right for you.
Yeah, and it's a difficult thing, isn't it? Say it's got to feel right, but it absolutely has. And we all have that gut instinct. If we feel something's wrong, it is. And Marc, Sophie said pretty much anything I would like you to say, but could you just talk a bit about the perils of cosmetic tourism?
Oh, sorry.
And why people really must not do it?
I always preface any comment on cosmetic tourism to say that there are some fantastic surgeons in every country in the world, and also there are some less reputable surgeons in every country. There are multiple problems. The cosmetic tourist industry is predicated on low cost, which is only a result of lack of regulation, lack of aftercare, lack of oversight, and really standards that wouldn't be acceptable over here in the UK or most Western countries. So I would urge anyone thinking about cosmetic surgery in another country to really question whether they would put up with the offering if they were to have surgery. And I'd be, excuse me, I'd be very circumspect about it and very cautious.
Wonderful. Thank you so much. Marc Pacifico, thank you. Sophie Shotter, thank you so much.